Taylor Erwin. It's March 9th, and this is my cranial nerves 1 through 12 video. We're going to start with cranial nerve 1. So I'm going to have you plug one nostril and inhale, and the other one, and inhale. Checking for congestion. Can I have you close both eyes? Can you plug one nostril? Inhale deeply. The other one, inhale. Can you identify the smell?
Yes.
You can open your eyes. Is the intensity the same on both sides?
Yes.
What was the smell?
Cinnamon.
Perfect. Moving on to cranial nerve 2, fundoscopic exam. I would turn the lights off, but I can't because I can't hear. So go ahead and look at that fixed spot on the wall. Checking for AV, nicking, hemorrhage, and glaucoma with this. And you're good. Now the next portion of that exam is going to be the visual fields. So son, I'm going to hold up a 1, 2, or a 5. You're going to stare at the cross on my chest, close one eye, and tell me what numbers you see.
1, 1, 5, 1, 5, 1.
Okay, close the other eye. Keep staring at here.
1, 5, 1, 5, 1, 1.
Okay, good. Now going on to direct and consensual lighting. I'm going to be checking to see if his pupils are constricting directly and consensually. So if I'm shining the light in his left eye here and the right eye doesn't constrict, it's a cranial nerve 3 lesion. If I shine the light in his left eye and neither of them constrict, it's a cranial nerve 2 lesion. And the next portion of this is the swinging light test. Again, we're just checking for constriction of the pupil. One abnormality you can have with the swinging light test would be a Marcus gun pupil. And both of his constrict. So now I'm just going to be looking at him for any ptosis, any drooping of the eyes. Can you lightly close your eyes for me? I'm looking for any blepharospasms, and he actually does have some. Go ahead and open your eyes. And then going to just do some convergence and accommodation. So son, what I'm going to have you do is just look at my finger, and it's going to come in and out, okay?
Sure.
Okay, good. Now accommodation. You're going to look at my finger and then look at the wall.
Sure.
Look at my finger, the wall, finger, wall, finger, wall. Checking thickening of the lens here. Finger, wall, finger, wall, finger, wall. Good job. Okay. So now I'm going to be doing fields of gaze. So what I want you to do is keep your head straight, but you're going to follow my finger with your eyes, okay? Checking for end-stage nystagmus. Good. Now going on to cranial nerve 5 sensory and motor test. Can I see your hand? This is what it's gonna feel like. Is that okay?
Yep.
Okay. I'm gonna move your bangs out of the way for this. Is the intensity the same all the way through?
Yes.
Is the intensity the same all the way through?
Yes.
Is the intensity the same side to side?
Yes.
Is the intensity the same all the way through?
Yes.
Is the intensity the same all the way through?
Yes.
Is the intensity the same side to side? Is the intensity the same all the way through? Is the intensity the same all the way through? Is the intensity the same side to side? Is the intensity the same from top to bottom? Perfect. I'm gonna move on. Can I see your hand? It's gonna feel softer. Is the intensity the same all the way through? Is the intensity the same all the way through? Is the intensity the same side to side?
Yes.
Intensity the same all the way through? Intensity the same all the way through? Intensity the same side to side? Intensity the same all the way through? Intensity the same all the way through? Intensity the same side to side? Intensity the same top to bottom? Perfect. Okay. Now can I have you clench your jaw for me? Checking for muscles of mastication, temporalis, masseter. Open your jaw against my hand. Good. Cranial 7 motor test now. Can I have you open your eyes really big, close them really tight, puff your cheeks out like a pufferfish, and then smile? What's the funniest thing you've heard all day? Good. We're gonna do some hearing tests. So what I want you to do is close your eyes. Can you hear this? Tell me when you can't hear it anymore. Perfect. And
Now.
Good. And then we're going to perform Weber and Rhimes test. So you can go ahead and open your eyes, sorry. What I'm going to do is I'm going to put this on the top of your head. You're going to tell me if you can hear it louder in one ear or the other, if any.
Okay. The right side.
Right side? Okay. So since he hears it louder in the right, we're going to perform Rhimes test. I'm going to stick this on your mastoid process. Tell me when you can stop hearing it. No? Can you hear it?
Yes.
Okay, good. So for him, it appeared that bone conduction was greater than air conduction, which would be a ipsilateral conduction loss on that side. So if it would have been the opposite, if air conduction is greater than bone conduction, it's a neurosensory loss on the contralateral side. So we're going to examine your tandem gait, actually. Can I have you stand up? I'm going to have you stand right here facing this wall.
Okay.
What you're going to do is go heel to toe for about 5 steps. Go ahead and go. Okay, come back. You're going to do that same thing with your eyes closed, okay? I got you. Sit down. All right, and now I'm just going to be checking if he has any nystagmus after doing the vestibular. Tandem gait. So now I'm going to examine your tongue. Can you just open your mouth for me? Checking for any atrophy or fasciculations. Can you go ahead and stick your tongue straight out? If it deviates to one side or the other, it's a ipsilateral lesion on the side that it deviates to. Can you put your tongue on the side of your cheek? Checking for muscle strength. Good. Now, I'm going to look at your palate. So can you open your mouth and say ah?
Ah.
Ah?
Ah.
Ah?
Ah.
Okay, good. So if the palate does not rise, it's ipsilateral lesion on the side that it doesn't rise to. This is usually followed by the uvula going to the contralateral side of the lesion. And so now I'm going to put this at the top and the back of your throat. Is that okay? Okay. No. And he did have a gag reflex. Sorry, son. So if he did not have a gag reflex, but he could feel it, the cranial nerve 9 sensory portion would be working fine, so it'd be a 10 lesion. If he did not feel it and did not have a gag reflex, it's a lesion in cranial nerve 9 and 10. Okay. So now, can you raise your traps up for me? Push them down. Turn your head into my hand. Turn your head into my hand. For cranial nerve 11, and that concludes my cranial nerves 1 through 12 video.